unless you're on screen. So please get on
Okay,
screen.
sorry, I'm sorry.
All right. Are we live?
Give it 2 seconds to load.
Okay.
Okay.
All right. Are we live?
Yes.
Oh, okay. All right. Good afternoon, everyone. Apologies for the delayed start. This is the Subcommittee for Health and Social Services budget decisions. We have with us all the members of the subcommittee, in addition to the analysts who will be guiding us through the decision document. We will go ahead and begin, and we'll start with. Well, Andrew, why don't you tell us where we're starting?
Sure thing. So we'll be working through the document in page order. So we'll be starting with the Office of Deaf and Hard of Hearing and our analyst, Grace Pedersen. Grace, take it away.
Thanks, Andrew. Starting with the Office of Deaf and Hard of Hearing on page 3, DLS recommended concurring with the allowance. The agency concurred, the Senate adopted.
Motion to concur with the Senate.
Second.
There's a motion and a second. All in favor signify by saying aye.
Aye.
Any opposed? Motion carries. Moving on.
Going to the Department of Disabilities, starting on page 4, DLS recommended adopting narrative requesting data about the Universal Services Trust Fund. The agency concurred, the Senate adopted.
Motion to concur with the Senate.
Your second?
Second.
Second. Motion and a second. All in favor signify by saying aye.
Aye.
Any opposed? All right, motion carries.
To the Department of Aging, starting on page 6, DLS recommended adopting language about $3 million that was provided for information and assistance purposes. The agency disagreed and provided the information with their testimony, and the Senate rejected this recommendation.
Move to concur with the Senate rejected.
Second.
The motion to concur with the Senate to reject the language. There's a second. All in favor signify by saying aye.
Aye.
Any opposed? Motion carries.
The second DLS recommendation is to adopt narrative requesting waitlist data and the utilization of several programs that also received enhancement funding in the allowance. The agency concurred with this recommendation and the Senate adopted, but I'd like to turn your attention to a color page, which starts on the bottom of page 8, which also adds a request for demographic and geographic data be added to that piece of narrative.
Move to modify to color page 1 on page 8.
Second.
All right, there's a motion and a second. All in favor signify by saying aye.
Aye.
Any opposed? Seeing none, motion carries.
The final DLS recommendation for this agency is to adopt narrative on the Community for Life and Durable Medical Equipment Reuse Program. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
Motion and a second. All in favor signify by saying aye.
Aye.
Any opposed? Seeing none, motion carries. For the Department of Aging. Excellent. Just want to make it known that we have not cut anything from the Department of Aging this year.
Generous.
Go ahead, Sam.
All right, recommendations for the Maryland Commission on Civil Rights begin on page 11. DLS recommended committee narrative requesting reports on investigator staffing and caseloads. The Senate adopted on page 12. However, we have a color page with some additional House modifications beginning on page 13 and 14 to this modification.
What does the color page do, Sam?
So the color page adds the 2 points that are in italics, which is asking for additional information on case processing times and staff to case ratios by type.
Great. Thank you.
Move to modify to the colored pages.
There's a motion and a second. Any all in favor signify by saying aye.
Aye.
Any opposed? Seeing none, motion carries.
All right. The second page on the bottom of page 14, this is asking for committee narrative, requesting a report on the case resolution methods and processes.
Okay.
Which page is it?
Page
This
14.
is this color page 2?
Yes,
color page?
page 2 on the bottom of page 14.
Okay. Move to adopt the color pages.
There's a motion and a second. All in favor signify by saying aye. Any
Aye.
opposed? Seeing none, passes. Next.
On page 15, we have the budget recommendations for MIMS. The first is a narrative on emergency medical technician shortages. The agency concurred with this and the Senate adopted it.
Move to concur with the Senate.
Second.
There's a motion and a second. All in favor signify by saying aye.
Aye.
Any opposed? Seeing none, motion carries.
On the following page, page 16, the Senate added language pertaining to interfacility transports between Maryland hospitals. This was, of course, adopted by the Senate.
Move to concur with the Senate.
The motion is
Second.
motion and a second. All in favor signify by saying aye. Any
Aye.
opposed? Seeing none, motion carries.
On page 17, we have actions pertaining to the Maryland Health Benefit Exchange. The first of which is a notification of state innovation waivers.
Move to concur with the Senate.
Second.
Motion and a second. All in favor signify by saying aye.
Aye.
Any opposed? Seeing none, motion carries.
Second is still on that page, pertains to the reinsurance program and submission of program forecast and cost. The agency concurred with this. The Senate adopted this as well.
Move to concur with the Senate.
Second.
Motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
On page 18, we begin recommendations that pertain to the Maryland Department of Health, beginning with the administration's budget. The first of which is a recommendation for budget bill language that addresses staffing vacancies, including an item pertaining to the long-term impact of the facilities master plan. Although MDH did disagree with this, the Senate did add this language.
Move to concur with the Senate.
There's a motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Page 19, item 2, still in the administration, pertains to the placement of those who are court involved, either not criminally responsible or incompetent to stand trial. The department did disagree with this. However, the Senate added it into their package.
Move to concur with the Senate.
The motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Page number 20 contains a recommendation for committee narrative on patient and staff safety across MDH facilities. This item, the health department did concur with and the Senate adopted it.
Move to concur with the Senate.
All right, there's a motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
On page 21, we have the Office of Healthcare Quality. The first recommendation was DLS recommendation to increase the turnover rate, which would result in about $1 million cut. The agency disagreed with this and the Senate elected not to take this cut.
Concur with the Senate rejection of the DLS recommendation.
There's a motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
On page 22, we have some additional actions related to the Office of Healthcare Quality, the first of which was narrative added by the Senate that pertains to the flu vaccination offerings throughout the hospitals here in the state.
Move to concur with the Senate.
Second.
There's a motion and a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Below that for you, we have an additional item for your consideration. This pertains to complaints of patients with Alzheimer's in nursing homes. OHCQ, of course, is the regulatory body for those nursing homes.
Move to adopt the color page.
The motion and a second to adopt the color page. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
On page 24, we have the first recommendation for the professional boards and commissions. This first recommendation would restrict $100,000 from the Board of Professional Counselors and Therapists and $100,000 from the Board of Pharmacists due to some repeat audit findings. And after they deal with these repeat audit findings, we will release the funds. The agency did not provide a response, but the Senate did adopt.
Move to concur with the Senate.
second,
There's a motion and a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion passes.
Moving on to page 25, the second DLS recommendation is in regards to the Board of Dental Examiners and their failure to attain performance goals. The agency concurred with this and the Senate did adopt.
Move to concur with the Senate.
second,
Motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
On the bottom of 25 and onto page 26, you'll see the third recommendation regarding the repeat audit findings for 19 of the boards. The agency did not provide a response for this, but the Senate did adopt.
Move to concur with the Senate.
second,
Motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
On page 26, there's a DLS recommendation regarding the licensing and regulatory management system project taken on by the boards and a color page item that goes along with that right underneath. This would request that the Maryland Department of Health speak about the $8 million increase in their project. And the color page did add another ask for that report. The agency disagreed initially, and the Senate adopted the initial recommendation.
Move to modify to the color pages.
second,
There's a motion and a second to modify to the color pages. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
On page 27, you'll have another DLS recommendation. This is for the special fund appropriation, and it would restrict $100,000 from the Board of Nursing, again, in regards to those repeat audit findings. The agency did not provide a response, but the Senate adopted.
Move to concur with the Senate.
second,
Motion and a second. All in favor signify by saying aye. Any opposed? Motion carries.
On page 28, you'll see a request to adopt narrative regarding the cybersecurity impact on the health occupations boards. The agency disagreed with this recommendation, but the Senate adopted.
Move to concur with the Senate.
second,
There's a motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
And the last boards item is on page 29. This is an additional first house action from the Senate, and it requests that the Board of Nursing submit an additional report about complaints and the way that they are investigated. The Senate did adopt this.
Move to concur with the Senate.
second,
With a motion and a second, all in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Okay, then on page 30, this begins public health services. This first action is language restricting funds pending a report on the Office of the Chief Medical Examiner, accreditation status, and then recruitment and retention. MDH disagreed with this DLS recommendation. The Senate modified it. So on page 31 and on to 32, there is added information requests that have to do with any backlogs the agency is facing, FEMA assistance it's received, and then the status of hiring a new chief medical examiner. And the Senate adopted that modification.
This is where we were. Oh, this is about timing about reporting. Move to concur with the Senate modification. However, let's grant MDH a new report date of 12/1/2022.
second,
All right, there's a motion to concur with the Senate modification of the language, but to amend it to move the reporting date up to December 1st. There's a motion, a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Okay, so then at the bottom of page 33, item 2 is a recommendation for language restricting funds pending a report on public health personnel recruitment and retention. MDH disagreed with this, and the Senate again modified this recommendation. So on page 35, you'll see that they adopted the same language, but just restricted 250,000 instead of the 500,000, and that's to be consistent with an earlier action they had taken. So the Senate adopts that modified version.
Move to concur with the Senate modification.
second,
There's a motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
And then at the bottom of page 36 and going on to 37, DLS recommends narrative that also has to do with the Office of the Chief Medical Examiner. And it's specifically on higher education programs for graduating more forensic pathologists. MDH disagreed with that narrative and the Senate adopted it.
move to concur with the Senate,
Second.
There's a motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Okay. So then on page 38, this begins the Prevention and Health Promotion Administration. DLS recommended concurring with the allowance. MDH concurred with that. The Senate actually rejected that in favor of adding the narrative that you see on page 38. And this requests a report on mobile COVID-19 vaccine clinics and missions.
move to concur with the Senate,
Second.
There's a motion and a second to concur. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
And then on page 39, there's an additional item for your consideration today, color page item 1. This is language that would restrict $250,000 pending a report on Medicaid claiming in school-based health centers.
move to adopt color page number 1,
Second.
There's a motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Your actions pertaining to the Behavioral Health Administration began on page 41. This first piece of language was a DLS recommendation that the Senate modified on page 42. However, if you go to page 43, we actually have a further modification of that. So the Senate's modification to that initial recommendation were in bold. They increased the amount withheld up to $1 million. And they also wanted to make sure that any forgiveness was pertaining to actual claims, given what we know now about the size of the overpayments. What this modification does on page 43 is in italics. And what this has is discussing about the total number of claims that are outstanding and still needing to be adjudicated by the ASO during that overpayment period.
move to adopt color page number 1, further modifying the recommendation,
Second.
There's a motion and a second to amend the language that the Senate put in. We have a motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
All right, on page 45, we return to DLS recommendations, the first of which is on item number 2 is annual language that restricts provider reimbursements to only be used within those provider reimbursement categories in BHA. The agency concurs with this, and then the Senate added it.
move to concur with the Senate,
Second.
Motion and a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Below that, item number 3, during our analysis, we caught a mistake in terms of funds that were using the wrong fund type. However, this was corrected in the governor's first supplemental, so the Senate rejected it because those funds are no longer there.
move to concur with the Senate,
Second.
There's a motion to concur with the Senate to reject the cut. As a motion and a second, all in favor signify by saying aye. Any opposed? Seeing none, motion carries.
On page 46, item number 4, DLS recommended some narrative around the telebehavioral health service utilization. The department disagreed, ultimately noting that they really only have that data for the public behavioral health system. And then what the Senate did right below that is grant them that flexibility to only be reporting on the public behavioral health system with that modification.
move to concur with the Senate and its modification,
Second.
There's a motion and a second to concur with the Senate modification. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
On page 47, similar situation where DLS made a recommendation pertaining to medication-assisted treatment. While the department largely concurred with this, they did request a December 1st due date, which the Senate granted them in that action below.
move to concur with the Senate modification,
Second.
There's a motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Page 48, we're still in BHA. The item number 6 is another piece of annual language similar to what was adopted previously, again, keeping those provider reimbursements in those categories. This is something that is concurred with by the department and then was adopted and added by the Senate.
Move to concur with the Senate.
second,
Motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Item number 7 is the third and final piece of this annual language, again, is concurred with by the department and adopted by the Senate.
Move to concur with the Senate.
second,
Motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Item number 8 continues a little bit of the budgetary cleanup. Here we had 2 budgetary mistakes that happened. One was the wrong fund type, which was correct in the supplemental. However, there was also some double budgeted funds. And so the Senate modified the recommendation to the following page on page 9, which just deleted the double budgeted funds. The department concurred with the fact that these funds were in fact double budgeted.
Move to concur with the Senate modification.
second,
There's a motion and a second to concur with the Senate modification. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Item number 9 on page 49, we'll then continue on to page 50. This is the item on the deficiency appropriation that pertained to the issues related to the ASO. What the Senate did on page 50 is just slightly clarify that we wanted to be looking at actual overpayments, again, consistent with that earlier reporting requirement.
Move to concur with the Senate modification.
second,
There's a motion and a second to concur with the Senate modification. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
And then page 51, we have the same piece of language and the same modification, just on a different aspect of that deficiency appropriation.
Move to concur with the Senate modification.
second,
There's a motion and a second to concur with the Senate modification. All in favor signify by saying aye. Any opposed? Motion carries.
On page 52, we are still in the Behavioral Health Administration, where the Senate added additional budget bill language pertaining to the state's pre-admission screening and resident review program.
Move to concur.
Recommendation- Oh, sorry. It continues onto the following page.
Thank you, Andrew. My apologies.
No, you're fine.
Move to concur with the Senate.
second,
There's a motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Starting on page 54 and on to page 55, you have the first recommendation from the DDA. And this is a general fund appropriation restriction on $1 million to DDA until they give us the community services program utilization data report again. The agency disagreed, but the Senate adopted.
Move to concur with the Senate.
second,
Motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
On page 56, we have the second recommended action. This would be to restrict any funds that come into community services just for that purpose. The agency
Morgan,
did
can I slow you down for one quick second? I apologize for killing
You're
the
okay.
flow here. I want to go back to Andrew for a second on BHA. In thinking about it, did we adjust the language on the ASO?
Mhm. That was the first item that we added kind of those additional reporting requirements on.
Can you remind me what the page number was?
Yes, it would have been color page number 1 in BHA.
What page is
Page
it on?
50.
Let's see here. The modification itself occurred on page 43.
For the recommendation, yes, absolutely. Thank you. Thank you. I missed that. I thought that was in there, but I just wanted to double check.
You're good.
All right.
so there's a difference between our language and the Senate.
There is a difference between the languages. Yes, we will have to reconcile that.
On that.
All right. Sorry about that, Morgan. Back to you, page 55.
Better safe than sorry. So
Yeah,
on
absolutely.
on page 56, the second recommendation for DDA is to restrict any funding that goes towards community services for that purpose only. The agency did not provide a response, but the Senate adopted.
Move to concur with the Senate.
Second.
There's a motion, a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
And the next DDA item, this is number 3. It has a corresponding color page on page 57. This would have the Department of Developmental Disabilities give us the community services utilization data on the 15th of every month. And we did do a color page to restrict funding until they provided that data of $250,000. The agency originally disagreed, and the Senate did adopt that first recommendation. So
Move to modify to color page number 1.
Second.
There's a motion, a second to modify to color page number 1, restricting funds for this report. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
And the last DDA item is on page 58 and on to 59. This is asking DDA to provide demographic data across the DDA community about different waivers and other things. And this was introduced by the House.
Move to adopt color page number 2.
Second.
Motion, a second to adopt the color page. Any all in favor signify by saying aye. Any
Aye.
opposed? Seeing none, motion carries.
Okay, so then on page 60, this begins actions related to the Medicaid budget. Item 1 is a DLS recommendation for language restricting funds pending a report on the Medicaid redetermination process after the public health emergency ends. MDH had originally disagreed because some of the data requested might not be available. So the Senate modified that to the action shown on page 61. You can see the differences in bold. And so that's the version they adopted.
Move to concur with the Senate as modified.
Second.
There's a motion, a second to concur with the Senate as modified. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Okay, so then at the bottom of page 62, there's another piece of language that would restrict funds pending a report on the home and community-based services expansion funding, and specifically the enhanced federal match that was passed in the American Rescue Plan. MDH disagreed as they report some data in quarterly reports to CMS. So the Senate rejected the DLS recommended language. There is an alternative starting on page 64 as color page 1, and that's for your consideration today. You can see the differences from the DLS recommendation in bold.
Move to adopt color page number 1, modifying the DLS recommendation.
Second.
There's a motion, a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Okay, and then on page 65, item 3 is annual budget bill language that restricts Medicaid provider reimbursement funds to that purpose, and you can't transfer it out except to Maryland Children's Health Program that's added this year. And so the Senate adopted that.
Move to concur with the Senate.
Second.
There's a motion, a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
At the bottom of that page and going on to page 66, this is narrative requesting a report on the MCO risk corridor settlements. And I'm sorry, the MDH concurred with this narrative and the Senate adopted it.
Move to concur with the Senate.
Second.
There's a motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
At the bottom of page 66, there's another piece of narrative for your consideration. It specifically asks about the community options waiver, financial and registry data on a quarterly basis. MDH concurred with the narrative and the Senate adopted.
Move to concur with the Senate.
Second.
Motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
At the bottom of page 67, this is the other piece of annual budget bill language that restricts funding in the Maryland Children's Health Program to that purpose. The Senate adopted it.
Move to concur with the Senate.
second,
Motion and a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
And then on page 68, there are two actions. Both would delete fiscal 22 deficiencies due to the federal funds being double budgeted. MDH disagreed and the Senate adopted both deletions.
Move to concur with the Senate on items 7 and 8.
second,
Motion and a second to concur with the Senate on both items 7 and 8. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
On page 69, the Senate added a piece of language that restricts funds pending a report on Medicaid rates and rate setting studies. And that goes on to page 70.
Move to concur with the Senate.
second,
Motion and a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
And then the last Medicaid item for your consideration is a color page that begins on page 70, goes on to 71. This would add narrative requesting a report on dental services rates under the Medicaid program.
Move to adopt color page number 2.
second,
Motion and a second to adopt the color page number 2. All in favor signify by saying aye. Any opposed? Seeing none, motion carries. Now we're moving on to the Health Regulatory Commissions.
The first item for your consideration on the Health Regulatory Commissions was DLS recommendation reporting on the COVID-19 pandemic and the Maryland model's impact of that. The Senate modified that a little bit, adding some discussion around surge capacity. However, there's a further modification of that for your consideration on page 73. This maintains the Senate modification as well as the original DLS language, but then also adds a reporting requirement around some of the additional funding that hospitals received from the federal government and other surgeon supports, and to what extent that went to increased costs for staffing and other assistance for the hospitals during this period.
move to adopt color page number 1, further modifying the recommendation.
Second.
There's a motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
All right, on page 74, the second item was a DLS recommendation pertaining to the evaluation of the Maryland Primary Care Program. This is something you all have done for, I believe, 3 years now. The Senate adopted that as is. However, color page number 2 on the next page, page 75, modifies this recommendation again and adds reporting on racial and ethnic diversity, both within the programs and providers. This was something that was reported on last year as well by the HSCRC.
Move to adopt color page number 2 to modify the recommendation.
Second.
Motion and a second to adopt color page number 2. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
On page 76 and continuing on to page 77, the Senate added language pertaining to behavioral health crisis services here in the state, and particularly asking or restricting funds for the Maryland Healthcare Commission to study the crisis services system.
Move to concur with the Senate.
Second.
There's a motion and a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
And then on page 78, we are still with the Health Regulatory Commissions. We have a color page item for your consideration. This is committee narrative pertaining to the Maryland Consortium on Coordinated Community Supports. This is a new blueprint initiative that is staffed by the Community Health Resources Commission here within the Regulatory Commission's budget.
Move to adopt color page number 3.
Second.
There's a motion and a second to adopt color page number 3. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Moving to the Department of Human Services, starting on page 79, DLS recommended to add language restricting funding for the Maryland Legal Services Program to that purpose. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
There's a motion and a second to concur. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
The second DLS recommendation is to adopt narrative requesting a department-wide recruitment plan. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
There's a motion, a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
The third DLS recommendation is to adopt narrative requesting a catalog of available data reports that will be made available with the implementation of the MD Think major IT project. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
There's a motion, a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
There's one color page for your consideration starting on page 81 that requests a report on the department's use of contractual full-time equivalents.
Move to adopt color page number 1.
Second.
Motion and second to adopt color page number 1. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
The recommendations for the Social Services Administration begin on page 84. The first recommendation is to adopt language restricting funds in the administration until a report is issued indicating corrective action taken to address repeat audit findings in the fiscal compliance audit. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor? There's a motion, a second. All in favor to concur with the Senate, signify by saying aye. Any opposed? Seeing none, motion carries.
Recommendation 2 on the bottom of 84, continuing on to page 85, is committee narrative requesting information on hospital stays by youth and out-of-home placements. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
Motion is second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Recommendation number 3 on the bottom of that page and continuing on to page 86 is committee narrative requesting a report on the status of the Family First Prevention Services Act implementation. The agency concurred and the Senate adopted.
Move to concur with the Senate.
There's a motion, a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Recommendation number 4, beginning on that page and continuing to page 87, is committee narrative requesting a report updating on the implementation of a new foster care provider rate structure. The agency concurred and the Senate adopted.
Move to concur with the Senate.
There's a motion, and a second. All in favor signify by saying aye.
Aye.
Opposed? Seeing none, motion carries. Sorry, my brain needed oxygen. Apologize. Keep going.
Contagious.
Sorry.
Recommendation number 5 on the bottom of page 87 is annual budget bill language that restricts general funds in the foster care maintenance payments program to that purpose only. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
There's a motion, and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Recommendation number 6 on page 88 is similar annual budget bill language restricting the general fund portion of the child welfare services program for that purpose only. The agency concurred and the Senate adopted.
And let's concur with the Senate.
Second.
There's a motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Recommendation number 7 is to adopt a narrative on child welfare caseload data. The agency concurred and the Senate adopted. However, there is a color page, actually a first house modification rather, beginning on page 90 and continuing on page 91. The Senate modified the DLS recommendation to add the portion at the bottom of page 91.
Move to adopt the Senate modification.
Second.
There's a
Mr. Chair,
motion.
may I
Yes,
ask a question?
sure.
I apologize. I know that we had that disconnect in our hearings between what the testimony we were receiving from workers in the field and then the data that was being provided by the department. Is the modification that we have there designed to help us kind of understand better the Child Welfare League standards and how they compare to average workloads here?
Yes, the modification is seeking to get a little bit more information on that. The department had previously indicated that the Child Welfare League of America, which is the organization that sets some of the standards for caseload ratios, was undergoing further studies to look at additional workload standards rather than just looking at the numbers for the caseload ratios. And DHS was indicating that they were going to be doing some further studies on that. So this bold narrative that the Senate adopted is seeking to dig a little bit deeper on that and get some more details on how the standards that are used in Maryland could be improved based on those studies.
I understand. Thank you, Sam. Thanks, Mr. Chair.
No problem. I believe we did have a motion and a second on that, so we were going to go ahead and vote. All in favor on that item signify by saying aye. Any
Aye.
opposed? Seeing none, motion carries.
All right, the final recommendation for the Social Services Administration is on page 92. This is committee narrative asking for a report looking into the impacts of economic instability caused by the COVID-19 pandemic on the child welfare system, specifically in the areas of neglect and reasons for under care, as well as low reporting of maltreatment. The agency concurred and the Senate adopted.
Move to concur with the Senate.
There's a motion and a second. Oh, sorry, jumped ahead of myself. There's a motion and a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Moving to the Child Support Administration, starting on page 94, DLS recommended to adopt narrative requesting a report on state and factors. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
There's a motion and a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
The second DLS recommendation on page 95 is to adopt narrative requesting a report on performance data. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
There's a motion and a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
There is one color page starting on the bottom of page 96 that would request information about participation in the Child Support Lien Network.
Move to adopt color page number 1.
Second.
There's a motion and a second to adopt the color page. Any all in favor signify by saying aye. Any opposed? Seeing none, motion carries.
The last page is for Child Support Administration is to request a report about the implementation of the child support management system.
Is there a color page with that?
That is the color page.
Oh, move to adopt color page number 2.
Second.
There's a motion and a second to adopt color page number 2. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
The actions related to the Family Investment Administration begin on page 100. The first recommendation is committee narrative that requests information on application processing times, denial rates, and case closures. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
There's a motion and a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
The second recommendation begins on page 101 and continues on to the next page. And this is committee narrative that requests information on the number of children served by the summer SNAP and the participation rates. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
There's a motion and a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
The next recommendation begins on page 102 and continues on to page 103. And this is committee narrative requesting that information on the spending in the pandemic EBT program be reported separately from the regular SNAP program. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
There's a motion and a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
The fourth recommendation begins on page 103 and continues on to the next page. So this recommendation is committee narrative requesting information on the increased utilization in the benefit cliff program for the temporary cash assistance and job retention bonuses the department says it's going to offer with some stimulus funds. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
There's a motion and a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Motion carries.
And then beginning on page 105 and continuing on to the next page is an additional piece of narrative that the Senate adopted. So this narrative requests information on the changes to the educational and experience requirements that the department indicated it was planning to undertake for the family investment specialists. And so it talks about the impact, the timeline for those changes and the impact of that on new employees, as well as the impact on current employees, and also compares to other states.
Move to concur with the Senate.
Second.
There's a motion and a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
And that's all I have for family investment.
Okay.
Right. The Office of Home Energy Programs recommendations begin on page 107. Our recommendation number 1 is asking for a committee report on energy assistance benefit application processing times and denial rates. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
There's a motion and a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
The second recommendation on page 108 is committee narrative requesting a update on the department's efforts to implement categorical eligibility for the determination of eligibility for energy assistance benefits. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
There's a motion and a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Recommendation number 3 on page 109 is committee narrative asking for a report on the income household water assistance program and the use of federal stimulus funds to establish that program in Maryland. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
There's a motion, a second. All in favor signify by saying aye. Any opposed? Seeing none, motion carries. And last but not least,
on page 110, this is for the Department of Housing and Community Development. The first item, DLS recommended making funding for the Project Restore program in fiscal 2023 contingent on legislation establishing the program in statute. The agency disagreed and the Senate rejected this recommendation.
Move to concur with the Senate.
Second.
motion, a second to concur with the Senate. All in favor signify by saying aye. Any opposed? Seeing none, motion carries.
Next and final item is a color page related to the Homelessness Solutions Program. This is narrative requesting a report from DHCD on the use of Homelessness Solutions Program funding, as there's an additional $5 million in general funds for the program in the budget.
Move to adopt color page number 1.
Second.
There's a motion, a second to adopt the color page. All in favor signify by saying aye. Any opposed? Seeing none, motion carries. Can I get, that is all for the the various analyst reports. Thank you all. Can I get a motion to adopt?
Mr. Chair?
Yes.
Oh, pardon me.
Sorry, go ahead.
Continue. I was going to ask the question about the DHCD budget.
Please go ahead.
Thank you, Mr. Chair. I know that we were looking at language at one point that would have the department conduct a survey or a study of the state properties that may be available for affordable housing opportunities. I know that we thought that maybe that would be better suited in another budget and perhaps some other plans for that as well, based on a bill that was filed. Do we know if that found a way in another budget, or are the other plans being looked at?
So it did not, there was some confusion about which budget it was going to go into and how we were going to handle it. The Senate sponsor of that bill was originally supposed to get it in on their side. We are speaking, and we think that there might still be an opportunity during conference to do that, since it's narrative. So we will get it in. We just weren't able to do that in this budget.
Okay, thank you, Mr. Chair. I appreciate it.
No problem. All right. Any other questions? Seeing none, at this point, I'd like to take a motion to adopt the subcommittee's budget as a whole.
Move to adopt the subcommittee budget.
Second.
There is a motion and a second to adopt the budget as presented. All in favor signify by saying aye.
Aye.
Any opposed? Seeing none, motion carries. Thank you all very much. We still have some work to do. First of all, before we do that, I want to thank the analysts for all of their hard work. They have been great. This budget is shaping up to be, frankly, pretty incredible. And we can take a lot of pride in the work that we've done for it. We have about 5 bills to consider as a subcommittee before we shut down. Before we do that, though, I'm going to request 60 seconds from everyone. I have to go do something real quick and then come back. So give me about 60 seconds, and then we will come back and do the 5 bills and then move on. I know Delegate Young, you and I both have another subcommittee to get to. We'll do it as quickly as I can, okay? So give me 60 seconds. Okay, I'm back. Okay, host, can you restart the video? Okay. All right, we are back. Thank you, everybody. Appreciate the very quick indulgence. My dogs were outside the entire time we were doing that budget, so they're having a great time running around in our big backyard, but they have to come in. All right, we do have 5 bills to consider. Let me pull them up real quick. These are all bills that we have heard fairly recently, I believe, for all of them. So we have to consider them and then move on to let them move on to the full committee. So we are going to start with HB 660.
Mr. Chairman.
Yes.
Real quick, sorry. You have a quorum without me, right? I apologize. I have not looked at any of these yet, and I know you just heard them, but I have no idea what I'm voting on yet. So I might just step aside and just wait for full committee. Because you said there's 5. I made a mistake and I hadn't checked any of them.
Okay. I mean, yes, we do. It's up to you. I'm going to go ahead and describe the bills. You did hear them. So it's entirely up to you how you want to participate.
Yeah, I'll wait. I just didn't want to hold you up and ask too many questions. I knew we got.
That's fair. It's fair.
All right, I'll wait. Yeah, I'll hold on.
Happy to have you. Okay, so HB 662, this is Delegate Guyton's bill. We did hear this one a little while ago. As a reminder, this is the bill that creates the Advisory Stakeholder Group on Autism-Related Needs, Interagency Disabilities Board, and the State Coordinator for Autism Strategy, Membership, Staffing, and Appointment. There are a couple of amendments on this bill. One is technical, two requires the governor to fund a support staff position for the State Coordinator for Autism Strategy and changes the effective date to October 1st. So there is a minimum fiscal note on this in order to hire that state coordinator. But other than that, there is no fiscal note. And, the bill is primarily creating the stakeholder, making adjustments to an existing stakeholder group.
Move the amendments.
There's a motion to move the amendments. Is there a second? Second. All right, thank you. Delegate Henson, are you with us? I don't know if you're here with us or not. Okay, we have a motion and a second. All in favor of the amendment signify by saying aye.
Aye.
Any opposed? Seeing none, can we get a motion on the bill?
On the bills amended, move the bills amended.
Second.
There's a motion, a second on the bill as amended. All in favor signify by saying aye.
Aye.
Any opposed? Seeing none, thank you very much. We're going to
Can I
move.
ask just before we move on, just a question? I do see that it's Delegate Guyton's bill, but the amendments say Delegate Resnick. Has Delegate Guyton seen the amendments or?
Yes, no. She's
Okay.
my understanding is everything is comfortable. Yes.
Okay.
Okay, it's Delegate Resnick because I'm the chair of the subcommittee and we have to get him drafted up. So.
Oh, no, that's fine. I just thought I would check.
Yep, no, understood. We're going to move on now to House Bill 1041. That is our own Delegate Valentino Smith. This is the Department of Human Services Family Investment Program Contract and Program Review. We recently heard this bill. There is an amendment that strikes performance-based incentives for non-governmental contractors and compensation for specified stakeholders. It changes the start date for annual review and alters criteria in the review. The amendment also authorizes the department to reallocate funds to complete the review required under the bill. So we heard this one, I believe, a little over a week ago. So let's take a motion on the amendments.
Move the amendments.
Second.
There's a motion, a second on the amendments. Is there any discussion on the amendments? Seeing none, all in favor signify by saying aye.
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 Any opposed? Amendments carry. Is there a motion on the bill as amended?
Move
Move the bills amended.
There's a motion and a second. One of you motioned, one of you seconded.
Quick question.
Is there any discussion? Yes, Delegate Mangione.
Why should I be concerned about this one, Delegate Valentino Smith?
You're not.
Correct.
It's 1041. I heard from headquarters you should be fine on 1041.
All right, I'll be a yes for now. I'll take it first, though. I'm sure it's not.
Let's just study.
That's good. It is. This bill has no fiscal note. It makes some very needed modifications based on a work group that Delegate Valentino Smith has been a part of reviewing this issue. So I would not worry, even with your incredibly loaded question. So, all right, we have a motion and a second. All in favor signify by saying aye.
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 Any opposed? Seeing none, motion carries. All right, bill passes. We're now going to move on to HB 1043. This is the companion legislation to Delegate Valentino Smith bill that we just passed. This is the Family Investment Program, Eligibility, Work Experience, Community Service, and Reports Alterations. We have any amendments on this? Okay.
Yes.
Can you describe the amendments, June? Because they're not on my full report.
I was on, actually, I think Delegate Valentino Smith might be able to describe her amendments a lot better.
Okay, if you, all right, I just got to tell me what you're following the bill here. Hold on, let me look. Amendment number. Let me look at it. I just don't see it annotated in here. Amendment number 1 on page 1.
One would be technical. Amendment 2 has the substantive part of your amendment.
Okay, I'm just like looking at the reprint and the amendments, so I don't have the bill. So amendment number 2 starts where on the reprint? On page 45.
Do you know what they do? You could just tell us what they do.
Yeah.
Instead of just reading it. How about that?
So the amendments, sorry, I don't have them all in front of me, but as I recall, the amendments ensure that you have up to 6 months from the time you apply to start to find your work option and what's going to work with you in order to collect temporary cash assistance. The other amendment assures that you have an exemption for 12 months from going to work if you have a child. And the second one amends the bill to remove the requirement that was in not to have to report your number of work experience hours, but now you will. The department has suggested that they had some concerns with that, so we're amending it to take that out. The amendments ensure that you will be available for your work requirement to work 1 90-day work experience, which is the non-paid work experience in a 3-year period. I've been working with this so long, I'm sorry, I'm trying to. And we struck some of the concerns that the department had regarding how you keep track of work experience. We also clarified that work experience will, that wasn't an amendment, that was in the bill. I think that covers the amendment. Anyone has any questions?
Okay. Can we get a motion on those amendments? I'm assuming you're making that motion.
Move the amendments.
Second.
There's a motion, a second. Do we want to have any discussion on those amendments?
Yeah, I just have a quick question because I apologize, I was trying to listen to what Delegate
okay.
Smith said and then trying to read the concerns from the department at the same time. It's about 2 pages long. I just read the beginning. It was you said the amendments fix some of their concerns.
They do. The amendments address some of the concerns they have about the work participation rate experience. And in the hearing, we handed out a chart that shows how we're not close to even being in violation of the work participation experience. But the statute has in it a safety valve that we put in last time we changed the work experience to allow more education, and they were concerned about the work participation rate. So we put a safety valve in that says if you start to get close to where you think you're not going to meet your work participation rate, then you can stop doing this. So the safety valve exists for the department as it did last time we changed the work requirement with respect to education. So, and then also there's a flow chart that shows how long the department will have. So in the unlikely event that this starts to impact the work participation rate, the federal government would ring up the department and say, we have some concerns, and the department would then submit a corrective action plan as to what they're doing. So there'll be no threat of loss of federal TANF funds. And as I understand it, across the nation, states have not been threatened or lost their TANF funds with respect to their meeting their work participation rate, because the federal government is always working with the states on that.
Thank you.
Okay. All right. Any other questions? All right, let's take a vote. This is on the amendments. All in favor, we have a motion, a second, I believe. All in favor signify by saying aye.
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 Any opposed? Okay, seeing none, can we have a motion on the bill as amended?
Move the bills amended.
Second.
There's a motion, a second on the bill as amended. All in favor signify by saying, is there any discussion? Seeing none, all in favor signify by saying aye.
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 Any opposed?
It's
All right.
okay, it's okay.
I think I'm going to vote yes, and then I'm meeting with my colleagues in about 20 minutes, so we'll discuss there.
All right, give me a call from the colleague meeting as needed.
All right.
Thank you.
Bill passes. Thank you all very much. Moving on to, and I had this in 2 different emails, so give me a second. There we go. Moving on to HB 1026. This is Delegate Valentino Day. Valentino Smith Day. HB 1026 is Human Services Two-Generation Family Economic Security Commission membership and compensation. The amendment, there's an amendment to remove the stipend for the member with experience in poverty.
Okay. Move the bill, move the amendments.
I
Second.
appreciate it. Motion a second. Any questions on the amendment? Seeing none, all in favor signify by saying aye.
Aye.
Any opposed? All right, can I have a motion on the bill as amended?
Move the bill as amended.
Thank you.
Second.
Motion and a second to move the bill as amended. Any discussion? Seeing none, all in favor signify by saying aye.
Aye.
Any opposed? All right, motion, bill passes. Thank you very much. One more bill. Getting to it, HB 1451. This is a Delegate McIntosh bill, Housing and Community Development, Business Projects and Business Development Program, Financial Assistance. There are no amendments. June, can you give us just a quick summary of what the bill does?
Yeah. Basically, what this bill does is it just authorizes the CDA to provide financial assistance using a convertible promissory note. So it's basically just expanding the ways in which they can actually provide financial assistance. And it also authorizes that that it takes effect, that it's only actually effective from July 2022 to July 2026. So it's only for a temporary period.
A 4-year period, correct?
Yeah.
There are no amendments. Can I get a motion?
Move the amendments.
No motion, no amendments. Can I
Move
get
the
a
bill.
Move-
Move the bill.
Sorry.
motion on the bill, the second on the bill? Any discussion on the bill?
Just a quick question. June, I'm sorry, I don't have it in front of me. We didn't change the jurisdictions.
I'm sorry?
We didn't change the jurisdictions that can avail themselves of this or anything, did we?
No, there's no change in that. Mhm.
Thank you.
All right,
Chairman, this was the bill that Secretary Holt brought, right? If I remember correctly. Okay, thank you.
okay. All right, all in favor of the bill signify by saying aye.
Aye.
Any opposed? Seeing none, bill passes. That is all. Thank you all very much. I don't quite know yet when we're going to have the full committee readout on this yet, but it's going to be soon. Just stay tuned and I will see you all later. Thank you very much. We are adjourned.